Bienvenue ici,
Good
présent dans la
afternoon
conférence
and
et à cette
welcome
session pratique qui
to
va
this
commencer dans un instant.
EDUCAID conference.
Alors, je me
Welcome
présente, je
to
m'appelle
this
Carmen Boica, je suis
practical
infirmière psychiatriste
session. I
spécialisée en
am
santé mentale.
a
Je
nurse
travaille à
in a
Bruxelles et aujourd'hui, je
psychiatric
viens
ward specialized in
co-animer
mental
cette session
health,
avec le docteur Jacques
and
Leroy que je
I
vous
will
présente.
be the
Je suis
co-moderator
également porteuse
with
du projet de
my
cellulaire
colleague
Hugo qui
here
fait du
sitting
soutien avec
next to
humanité au
me.
médicament.
I am in
C'est un projet
charge
qui promeut
of
la santé
a
mentale en
project
RDC et dans les
focusing
territoires
on
africains.
mental health in
Donc,
DRC, but
pour
also in
commencer,
the
tout de
African
suite,
diaspora.
Jacques
I
Leroy.
now would like to give the floor to Dr. Jacques Leroy, who will start. A microphone, I'm afraid, is really needed so that interpreters can hear you.
Oui, c'est caché.
Yes, but the microphone is well hidden.
Leroy.
My name is Jacques Leroy. I am a psychiatrist. I have been working not only in Belgium, but also in the Netherlands and in sub-Saharan Africa. I have been working as a trainer on mental health issues. I have also been a consultant, and I have worked on the inclusion of mental health care in the various healthcare services. This is a policy which is aiming at focusing on mental health as a whole. It's not only about focusing on psychiatry. We're here to help people. We're here to make sure that access to care is easier in a primary care setting, but also at the level of communities. We will hear two presentations on this issue. We will hear about the models in place in different countries, and I think that we can start with Dr. Mifundu, who is joining from Kinshasa. You are a psychiatrist from the University of Kinshasa. You do work in the Center of Neuropathology at the University of Kinshasa. You are the head of a department. You have been in charge of a national mental health program, and you are now a consultant in many projects that for some of them, started with the support of other organizations. So I believe that you have the title here of our session, Promoting Mental Health amongst Youngsters, Challenges. And so we will now give the floor to our speaker. The floor is yours, Abraham. Hello, good afternoon. Good afternoon, Yag. Hello, everyone. I hope that you can hear me. Yes. Yes, we can hear you. You can start, but we no longer see you. No, I'm still here. May I start?
C'était très noir. C'était très noir là, tout à l'heure. Très noir, mais
Vous dites?
OK. Bon, commençons.
Je peux commencer?
May I start? Okay.
Oui. Merci beaucoup. On peut me faire passer la deuxième
So,
diapositive.
thank you very much. I think that
La
you
RDC,
can
donc,
have
je l'ai dit,
the second slide. So,
traverse une
the
situation de
DRC,
polycrise
my country,
liée
is
essentiellement
facing a polycrisis, and this is linked
aux
to
catastrophes
wars, natural
aussi à cause
disasters,
d'épidémies, mais aussi à la
pandemics,
situation socio-économique
but
et
also
politique
the
assez difficile que
political and
traverse.
social
Et cette
situation.
se complique souvent
This
et
situation in the east of the country is characterized by a high rate of school dropouts, the lack of
Il y
health
a
and
des
school
déplacements massifs de
structures.
population.
We also
Par
see
exemple, il y
massive
a 6 millions
displacements
de
of
populations qui se sont déplacées
populations.
vers l'est, que ce soit
6
à l'intérieur du
million
Congo ou même à
people
l'extérieur du Congo.
moved
Effectivement.
to other
Et cette situation s'est
regions in
aggravée
the
par
country, and the
l'émergence de nouvelles
situation
catégories
is
d'enfants et de
worsened by
jeunes
the
qui sont
emergence
touchés par les
of
conflits,
new
notamment les
categories of
enfants
children affected
déplacés, les
by
enfants,
conflicts, so
les
displaced
enfants
children,
réfugiés, des enfants
refugees,
qui sont atteints de nouvelles maladies
children with new
comme l'Ebola.
pathologies
Il y
such
a
as
des enfants
Ebola.
victimes de violences
You also
sexuelles
have
et des
children who are
enfants
the
en
victims
situation de
of
risque, voire
sexual
même
violence
ceux qui s'abusent à la consommation de substances
and
psychoactives.
victims
Bref, il y
of
a toute une
various
litanie d'enfants
types of
qui
abuse. So we see
résultent,
now
une
the
nouvelle catégorie
emergence
d'enfants
of
qui résultent de cette
new
situation de
categories
polycrise.
of children. And
Et,
this is really the result
et
of this
il y a 3
polycrisis.
programmes nationaux de
There
santé
are
qui
three
viennent en réponse
national
à cette situation.
healthcare programs
Et ces 3
trying to
programmes, ce sont
give answers
c'est
to
essentiellement le
these
programme national de
situations. So
santé
there are
mentale,
national
qui est le leader,
programs
le programme
in
national de santé
mental
de
health.
l'adolescent et
We
le programme
have
national de santé scolaire
a
et
national one,
universitaire. Alors, tous ces 3
for
programmes recommandent à ce
teenagers.
que les
We have
actions de
3
santé
national
mentale et de
programs,
soutien social
and the idea is to make
servir à
sure
ces
that
enfants
the
soient
various
nécessairement
services
holistiques,
should be
multisectorielles
based on a
et
holistic approach, a
stratifiées, mais aussi que ça
multi-sectorial.
puisse
They should be
respecter aux
stratified,
conditions de
and
référencement
they
pour
should
assurer la continuité des
also
soins. Alors,
apply
nous allons
to
vous
a
partager
benchmark so
cet
that we can
après-midi des
guarantee
expériences
a
et
care
finalement une
continuity.
lettre
So this afternoon, I would
d'application
like to
issue
share
de ces stratégies
some
promues par ces
experiences
3 programmes.
linked to the implementation of those three national
Le premier
programs.
cas,
The
c'est celui
first
dans
case
lequel on fournit le soin de
is
santé
the case
mentale et le
in which
soutien
we
psychosocial
provide mental health
aux
care
élèves,
and
mais aussi nous
psychosocial
ferons un petit
support
bond sur
to
les jeunes.
students
Alors,
and
comme vous le
to
voyez, en fait, il y
youngsters.
a le
As
programme national
you can see, we
santé
have a
scolaire et
national
universitaire
school
par le biais
health
de
and
son bureau
university
santé
health
mentale,
programs. We do
organise dans les
have
écoles
a central
des
office,
comités
and we
de santé
organize
scolaire.
activities
Ces
in
comités de santé
schools,
scolaire
in centers.
sont
We
appelés
have
à
set
assurer
up
dans les écoles
school health
des
committees.
soins
Their
préventifs
aim
et des
is
soins
to work on
promotionnels.
prevention
Et
and
dans la
to promote
communauté, leur
healthcare.
action est relayée par les
In
comités de
our
parents d'élèves
community,
de cette
we
école-là,
also have
de l'école
committees
concernée.
of
Mais à côté
parents
de ces
in a given
comités
school.
scolaires de santé,
Next to this
il y a
initiative,
création des dispensaires scolaires
we
dans les
also
écoles
have
et les dispensaires, lui,
health
s'occupent plus
centers
spécifiquement
in
des soins de
schools
santé, y compris
dealing
les soins de santé
with
mentale et de soutien
healthcare and
psychosocial.
also
Il est assuré
mental
par un
health
personnel fixe
care. So we
et
have
qui est
staff
attribué
available
par les
there in
psychologues
those
qui sont
centers.
affectés
They are
par le
helped and
programme national de
supported
santé scolaire et
by
universitaire.
psychologists, and this is
Et
in a
quand
national
jamais,
framework.
si jamais, le dispensaire est dépassé par les cas, eh bien,
Now,
il
if there
réfère
are too
dans les
many
structures
cases
spécialisées
to deal with, there is
formelles.
always a
Mais
referral
aussi, ces dispensaires
possibility
sont ouverts
to
aux
other
entreprises qui ont la
specialized
possibilité d'offrir
centers.
des soins
In
à la
those
communauté.
centers, you
Mais
can really provide
cette
a
situation, c'est pas en
service
temps normal.
to
Ce sont des structures
communities.
pérennes,
So
formelles.
those
Eh bien, en
are
cas de crise ou
formal
de polycrise,
structures,
eh bien,
sustainable
la santé des
structures,
enfants,
and in
de
case
savoir
of
la santé des
a
élèves est
crisis,
pris au même moment que les autres enfants
the
dans
health
le
of
camp de
students
réfugiés,
really
dans le
becomes a
site de
priority.
traitement.
We
Et là,
also
ils sont pris en
address
charge par
the
des
health
structures bien
conditions
spécifiques
of
qu'on
children
appelle
in refugees
des
camps,
espaces
for
amis pour
instance.
enfants, pour les jeunes, et aussi des
We
espaces
have opened
temporaires
dedicated
d'apprentissage pas pour les
spaces
enfants d'abord et pour les jeunes
for
dans les
children
espaces
and for
temporaires
teenagers,
d'apprentissage
and those are temporary
rencontrés par ces
learning
objectifs. Alors, le
spaces
deuxième
or
cas,
centers. The
c'est un
second
cas assez
case
particulier,
is a
c'est
very
celui
specific
d'un
case.
projet d'offre de soins de
This
santé
is a
mentale et de soutien
project
psychosocial, mais ici
in the
particulièrement
framework
aux
of
enfants
mental
en
health
proie à
care,
une situation
but we
d'addiction.
do
En fait, c'est un
target
projet dans lequel nous
children
avons
who are
beaucoup participé,
addicted. We have
qui
been
a été mené
involved
dans un
in this
centre
project.
d'hébergement
It was
qu'on appelle
conducted
CREX.
in
C'est un
a
centre
hosting
d'hébergement des enfants
center This is a hosting center for children in the streets. The specificity of this project is that we have worked with 3 categories of stakeholders. Children, first, they were actively involved. At the start, children themselves defined their own objectives, their own activities that they had to perform with the help of educators and staff. So it was in a way a community dream for them. It was to live in a drug-free world. Then, in a second step, if I can have the next slide, please. With the help of their educators, they defined an action plan. So they defined what they wanted to do within the framework of the project, the types of activities that they wanted to perform, the timeline as well, the conditions. So they defined a fully fledged project, and once this was done, they implemented it. And the next slide, please, if I may. So you will see that they were able to conduct activities, and this allowed them to strengthen their abilities. So you can see here that they were organizing educational talks with the assistance of their social worker. On top of that, so you see this here in the street, they were able to help other street children. They organized awareness raising, and this was done once again with the support of social workers. If I can have the next slide, please. Next to them, there is another category of stakeholders, the team of experts. And so I was one of them, and we have been able to establish children categories according to their needs. This team of experts was able to train 3 educators, and so they were able to provide assistance to the youngsters. And during the activities, we were able to identify specific cases. We were able to provide support and assistance. The 3 educators were involved, and if the case was too hard for them, they would refer the case to a psychologist. And so those are local activities, those are local actions. So it is always possible to ask for a psychological support. We can work with professionals, and if really it's too hard to deal with, there is always a referral to other experts. So there is this referral procedure to neuropsychiatrist as well. And so there, again, at that level, it is possible to provide a specialized care to the child or the youngster in question. And if those experts are really, or if the case is too overwhelming, the case is referred to a specialized structure. There is also a third category. The families played a key role as well, because the bottom line is to work on the integration. We have been able to see 3 examples where there were very good links and bonds between children and their relatives and their families. Thank you very much.
Alors, on a du temps pour quelques questions de
So I
clarification.
think that we have the possibility to take some questions. So I do not know whether you would like to intervene.
Discussion plus élargie. Qui a peut-être une question?
So who has a question?
Parfait, tant mieux.
Oui, bonjour. Je voulais demander
Hello,
si ces
good
enfants
afternoon.
dans la rue étaient
I would like to
considérés
ask a question about the street children.
que c'est la raison pour laquelle ils sont dans la rue.
Why are they in the street?
Oui, j'ai compris.
I don't know whether you have understood
Effectivement,
the question.
Si dire peut-être la majorité c'est trop, mais la grande partie
Well,
d'enfants étaient qualifiés sorciers.
I think that, yes, you are right. Those children are considered to be, in a way, wizard children. Most of them as well, because of course, as they are on drugs, you know, they display rather awkward behaviors. So we knew that they are considered to be as such. And of course, this is cultural. This is due to the circumstances. It's because some of them were using drugs. But it's true that they are considered as such, and that's also the reason why they are in the streets. I do not know whether we can take one more question or maybe two additional questions very quickly. So you worked with families and communities. I would like to know how you have been able to raise awareness about the drug addiction problems, and what about the reintegration of those children?
En fait, comme vous venez de le voir,
Well, as you have seen, the key stakeholders are the children themselves in the various structures that we implemented. Children were advised by the team members, so they had to conduct and to carry out some activities, and they were really key players. If you take the street children, and if you take the streets, those activities were well known, so they would first raise awareness because, of course, they had been living in the streets before, so they knew how life is organized in the street. They knew that there were leaders in the streets. And so an action plan was defined and prepared, and so this would be done in collaboration with educators. And I think that they were able to get the message across because those were people that they had seen already. They had been living with those people in the streets before. The second strategy was the search for parents. We were able to trace back the parents, so we were able to look for the parents of those children who were staying at the hosting centers. I have in mind 3 cases where we were able to find the parents, so we raised awareness as well with the parents. They went to the center. So we talked about the advantages for their children of staying there, but we also talked about drug use. So we talked about the possibility for them to have their children back with the family. And as you know, those children had been considered as wizards in a way. And of course, parents were a little bit scared because they were, you know, wondering how they would behave. But I have to say that we worked with psychologists. Some parents were traumatized to have one of their children living in the street, being on drug, behaving in a very strange way. So the parents themselves were able to benefit from some psychological assistance as well. So we will stop here, if you don't mind, and we will be able to address this maybe later. Now, I think that there was a second question of clarification.
Oui, merci beaucoup. Dans la famille, est-ce que
Thank you.
retour à l'école?
Thank you very much. So you talked about returning to the families, but what about the return to school? Is it a possibility for these children? Can they go back to school? So the question was to know whether a return to the school was possible. Well, I can say that for some of them who were staying within the hosting centers, they would already go to school. And so, as they were able to go back to school, they would still be in touch with the structure, with the center, with the educator for 6 months. And the educator would go to the school on a regular basis to check on the child. So I think that we can now move on to the second presentation. And thank you very much indeed, Dr. Mifundu. So I would like to introduce now two persons, Mrs. Véronique Kranenbroek and Kathleen de Kerkhove. So I think that this will be a presentation as a duo. Véronique, you are the co-director of the International WAPA organization, so you will tell us what it's all about. And Kathleen, you are the vice president of the Children of Pansy. Now, the floor is yours. So the theme is how to host children who have been traumatized by many situations.
On a un sacré défi aujourd'hui qui est de vous présenter deux organisations en 10 minutes. Donc on va parler très très vite et on va essayer de vous laisser beaucoup de temps pour les questions et on ne pourra pas être exhaustif malheureusement sur nos approches. Alors, en 2015, le docteur Mukwege, que vous avez probablement déjà rencontré sur votre route, faisait face à un nouveau problème, qui sont les enfants de plus en plus jeunes qui arrivaient sur sa table d'opération complètement détruite, ensanglantée, qui était le résultat de viols par une milice armée. Et donc, ce docteur Mukwege savait les réparer physiquement. On n'aime pas tellement le terme réparer, mais il pouvait intervenir au niveau de la réparation chirurgicale. Mais après, il était obligé de les envoyer dans le village, sachant pertinemment bien qu'il n'y aurait aucun...
To send them back in the village, knowing that there would be no psychological follow-up, and these children would be rejected by their family, by their community, and they would have no hope. Then we met Dr. Mukwege in 2015. I was with 3 odd people, and we created our association, Children of Pansy and Elsewhere. And indeed, the idea was to have a general and holistic approach in villages. But as you know, children, they never come alone. The idea wasn't to support the child only. We wanted to support the family, community, teachers, and therefore we developed a new method, a new methodology with individual therapies, with group therapies based on the Eugene bird therapy. This is the game therapy, which means that indeed we can deal with a lot of children. We had more than 50 children at the same time, and we could also mix the children who had been victimized with the non-victimized children. We also organized awareness-raising campaigns, prevention campaigns. Unfortunately, we do not have the slides. Could we see the slides, please? Yes, here. So we organized campaigns, awareness-raising campaigns within communities and with teachers. Yes, my name is Veronique Krenenbroek. I do represent WAPA International. I founded this association with my colleague in 2013, and the idea was to support the reintegration of soldier children after that had been enrolled in armed groups. And we talk about a community reintegration and a family reintegration. How do we work? We do work in hand with local partners in conflict affected areas, and we also do support reintegration programs. In Belgium, we do organize awareness raising campaigns. We just talk about, or there is a plea against children, soldier children, and we want to put an end to this plague. Well, the reason why we have this joint approach, it is because our target groups were quite similar. There is a kind of intersectionality between child soldiers who had been recruited voluntary or involuntary. Then we had children sexually abused and children born from a rape. For those who had been sexually abused, we talk about, of course, exploited, instrumentalized children by armed groups in order to improve their domination. And when we talk about rape, we are talking about indeed children used as a war crime against their own mother. It's true. It's true. We came basically to the conclusion that the young girls we had in our centers had been basically sexually abused, and all when they were mother, all their children were a result of rape, and we also had saying there were a lot of symptoms, and from a professional point of view, we had to do something. This is the reason why we called upon enfants de Pansy, children of Pansy, because they are experts in trauma. For instance, we think about well, post about PTSD in children, also daily trauma, physical attitude, the idea of avoiding or controlling, also the negative effect on your thought, the dissociation, alteration of the process. These are symptoms indeed, but we have to deal with these symptoms in order to support those children and also in order to encourage them to go back to school. And of course, we have a community framework, which means basically parents have to be supported as well when children are traumatized. Often the mother is traumatized. She doesn't know what she has to do, how to support her own child also when he has or she has to go to school. So we are basically working hand in hand with families. So we talk about psycho education and we do support children. What is important is that the child is basically seen as a victim within the community, because we are talking about extreme precariousness, poverty, and mother who have been raped. She will often have to move to go in another village and to be basically invisible. For us, it is very important to organize awareness raising workshops on different topics, equal opportunities. Of course, being successful in school or at school rather, also the goal number 4, access to school. sustainable goals, and so on and so forth. The children of our program, at the end of the day, were the best at school or in school. And we were very happy, but at the same time, we were very sad because we came to the conclusion these are victims. So we decided to disseminate these campaigns, to broadcast these campaigns, and to basically be able to contact much more people in villages. And this was very positive. So indeed, we are also working we are organizing advocacy because this is very important for education. This is a real plea. So you don't have only to look at the medical aspects. We also have to take into account education and schools, mental health. Of course, if you have suffered from PTSD, you will not be able to focus to work hand in hand with others. I could really enter into the scientific details, but we need to support that child to be able to go over this PTSD, and a child which can become very violent because of the PTSD. At one point in time, you might be rejected at school, and even it might drop out. So we have to inform teachers to protect the child and not to reinforce the trauma. And the school or schools have a very important role to play to stabilize a child after a trauma. It is very important to find a new framework, to find a new routine. We're talking about rituals, about being able also to express what he has been through, where he can have friends, where he can be socially supported with a network. Very briefly, I'm going to talk about Angèle. She was raped. She was 3 years old. Angèle, this is not a real name, but Angèle arrived in our program 3 years after the rape was committed. Physically, she was all right, but mentally, it was a disaster. She couldn't work, and she was seen as being a social, and she had also dissociative episodes after our program. Angel was much better, and well, these symptoms basically almost disappear. So psychoeducation, talking with teachers, the support she got, this helped us. She has more self-esteem. She wants to learn, and Angèle tells us today she wants to become a nurse. She's 16 years old and she wants to take care of others. So very briefly, you understand why the synergy it is important for us, because all our girls are victims of sexual violence. So we wanted to work with those supporting these girls. So we are talking about basically reinforcements of abilities, of competences through learning modules. We have, for instance, the brief therapy, the follow-up therapy, public, these children, of course, and sometimes they are also in a transitional family after their liberation. And the results were fantastic because they were supported, they were listened at, better coordination, cooperation between the partners. Capacity building is also essential. And we came to the conclusion that teams are there to take care, but also to support children. And this is a virtuous circle. At the end of the slide, you will find a testimony, but I don't think we have the time. Yes, we have the time. Okay. And the psychologist who says, thanks to these training session, we got all the necessary tools to support these children coming out from armed group. A child who was a beneficiary of our program, we felt secure thanks to the support of the psychologists and then the director of the BVS. This is our local partner. The activities of our psychosocial partners, this supported us during this unsafe period. We want definitely to thank them for that. As regards these three little testimonies, I wanted to share with you that if the conflict keeps going, often we say, okay, NGOs, Belgian NGOs have to leave. Well, no, definitely no. We have to remain there in situ. Thank you very much for your attention indeed. Okay, thank you. Thank you very much indeed. I imagine that we have also clarification questions, no? Any question? Oh, it's crystal clear. I'm Caroline. Maybe a question. Well, you have already asked or tackled this issue. You were surprised to come to see that the children that their results at school were better, and this is often the case. I mean, if you have a shock, if you have been through a trauma, a shock, and if you are supported, which is not the case of the general population, and there is then also the silent suffering. And when we are talking about polycrisis, it's the whole society and which is submitted to all these difficulties. Based on your own approach, what can we rule out? What is relevant? Because we cannot do it for everyone, but maybe something global, a global approach and a community approach, not a targeted approach on these particular children. I think that in these communities, information is essential. These communities often have old beliefs, so we don't want to change communities, but we want to inform them, and for the information to get through well, we can broadcast, of course, on the radio broadcasting, for instance, people working in fields and with interactions, they can also ask questions, and we have organized debates on the local radio station with people having different ideas. We had community leaders, people from civil society, so people who didn't always agree, but whatever. And the questions could reinforce the debate and beliefs. Sometimes people change their mind. We also organized some video campaigns on gender equality, importance of school, mental health. A physical symptom is not comparable to a mental symptom. This was very successful, and at present time it is in Ponzi, but you can share it with others. Okay? A clarification question? Yes, I'm going to try. I was wondering, because it's also culturally related, certainly for this tricky issue, and we in France, in Belgium, we have our own vision, and mental health, this is often, medicalized, and our problem-solving approach is often different compared to community. So I wanted to know what was your approach as regards the problem-solving
C'est évident que
framework.
quand on a rencontré le docteur Montpellier, la première chose qu'on
When we
a
met
fait,
Dr.
c'est
Oncolier, the first thing we
faisons
did
des actions de
was
volontariat,
going there
des intervenants
in the
qui
village. We
issus du domaine
worked with
qui connaissent bien
people
leur
coming,
communauté, qui
stemming
connaissent aussi
from
sur
the
du long terme, parce que
communities
le cycle d'un enfant, c'est
who
sur du
can
très long terme.
also organize a long-term follow-up, supporting a child. It's a long-term process. Sometimes you have to talk about latency. Sometimes at one point in time, the child seems all right, but after a few years, it becomes violent. So we can talk about a kind of co-creative process. And afterwards, we worked with our local team. We came up, for instance, with activities for therapeutical playgrounds. And in our Congolese context, how can we, for instance, introduce a specific situation? We used the body, we used the rhythm, and this has been scientifically validated. We analyzed data with the University of Liège, and we can transpose a specific model to another location, and you just need to reassess, to readapt each activity with the local community. Okay, I have just an additional information, and then we will have the last part Q&A and exchange on both the presentations, because we still need a little bit of time. So yes, your last answer, yes, as far as your question is concerned, how can we accept in our programs? It is not easy. We have a limited number of places, and if a child, for instance, comes in a center, goes to school, receives food, we know that it will attract a lot of children, and unfortunately, we are only expert in some specific traumas. We try to develop in the same time other solutions, playgrounds, daily hospitality. We have to find really alternatives instead of boarding school or residential school, but it requires a lot of money, of course. Thank you very much, Veronique and Catherine, for this session. Now we will have the Q&A session. We still have a question over there. Yes, and this is the idea. We want with Dr. Mifundo, we can maybe talk about the commonalities between both presentations. Of course, we are talking about target groups, so we are talking about mental health, but yes, the commonalities. Yes, thank you very much. Thank you very much. My question is, as far as the support we can give to those children, did you encounter parents who refused this support? As far as we are concerned, sometimes we have teenagers, they were traumatized, but because they are young, they need the authorization of their parents to get access to some legal services, for instance, or other services. And some parents do definitely refuse, reject this idea. They are afraid of consequences. They don't want the community to know that their child had been a victim, they don't want to be stigmatized. So I wanted to know, did you encounter parents who refused? I could broaden up the question because Dr. Mifunduket also intervened. Basically, when you have such an intervention where the family plays a key role for the future evolution of the child, do you have resistance popping up? And how do you tackle these resistance? And this is the case in both cases, literally. What can we do? So, working with families, resistance of families, this is an essential element. Mifundu, maybe you can intervene? Dr. Mufundu?
Le monsieur de la communication m'avait dit qu'il y avait un problème de communication, donc peut-être il n'est pas là.
Maybe there is a communication problem. This is a very good question indeed, because the children are stigmatized and parents don't want to talk about it. This was a specific case. These are the children of Kasmugo. More than 50 children. A baby 8-month-old was a victim, and they had been through pansy, but a lot of them haven't been through pansy, and maybe we didn't see them, but we wanted to focus on those who had been identified and also on the real victims, for those born after a rape. This is also very difficult. It's very difficult for families to speak up, and this is therefore we have decided to work with local partners, with community leaders, with families, not me of course, but local stakeholders. We are not there for money, we are there for mental health support, and then they tell us, okay, mental health, this is great, but we don't have money to feed our children. How can we get money to feed our children? You know, it's a time-consuming job. It took more than 1 year to launch our first program, and afterwards we could roll out other programs, and we definitely need the community leaders, we definitely need parents. Often the fathers have disappeared. As regards soldier children, I fully agree with what you said, but the phasing is totally different because the children have already left their families, their community, because they have basically decided to work force voluntarily or involuntary. In our center, we have therefore children who have been liberated, they are free, and they have, according to the law, they have to be reintegrated as soon as possible in their family, in their community. So therefore we have to raise the awareness of families, of mother, fathers, brothers, sisters, and it's not easy, and we know it's even more difficult to reintegrate girls who became a mother, and it's very, very difficult. It's very important also to come up with a social and economic solution. For instance, they need to earn money, because otherwise there will be an extra burden for their family. So therefore we need to come up with concrete solution, and this is the awareness raising.
À qui puis-je donner la parole? Peut-être.
So who would like to take the floor now?
De réagir, de donner un commentaire.
Who would like to react? May I react? I think that Mr. Mifundu would like to intervene.
Le genre de travail que vous faites, il faut des moyens financiers.
So, of course,
Beaucoup de moyens
it
financiers.
takes a lot of
Travail, comment vous
money. So how do you do?
En effet, ça demande beaucoup de moyens
So,
financiers.
yes, you're right. This is expensive. This is a long-term work. We know that donors do not necessarily want to support associations in the long run. Unfortunately, we cannot help a huge number of children. So we have to limit ourselves and we have to focus on quality instead of quantity. And so we do work with limited groups of children. Thank you. I have a question about training. So I have understood that you work with field workers and in the countries where I work, training is really weak, especially on those issues. So it's always an issue. How can you make sure that you do not do harm? And this is one of the basic principles in humanitarian work. Of course, you want to help, and you do not want to worsen the situation. So I would like to ask this question about the training of local workers. Well, of course, if you go to our website, you will see do not harm. This is really the key principle. Now, of course, well, maybe we did harm in some of the communities because the local workers do not necessarily have the tools. Are we going to stop? Well, no, because it's about repeating. There are always new clinical cases emerging. Together with the University of Liège, we organize online meetings as soon as when there's a problem. I know that we talked about religious beliefs of local workers. Well, it has nothing to do with the psychotherapy. So we have to get the message across that this has nothing to do with the work we try to accomplish on the field. So it's really about repeating things. It is a long-term task, and it's important to be able to retain your well-trained team members. Well, I do not know whether you have heard the question. So what can you achieve with the limited resources you have? And then it was a question about training. How can you train the stakeholders who are in touch with those youngsters? All right. Well, if you allow me, I would like to go back a little bit and talking about how we work with families. This is a major step because we are talking about children who have been the victims of many trauma. So they left home because they have been the victims of trauma, and they are now living in a new setting, and then they will have to go back to their family. So they will have to do away and to break the links that they have established with educators or with their schoolmates, to go back to their families. So this is quite hard. So what do we do? Well, first and foremost, we try to find the family. This is a first step. Once this is done, we organize interviews. We tell them, we inform them that their child is with us, is living now in a reception center. So we explain what he or she does. We tell them when their child goes to school. Is it the first year or the second year? And once this trust is established, we invite families to pay a visit to their child in the reception center. And if they do not want to do so, we try to organize a meeting and we try to make sure that it is their child who will go and meet with them. So if they accept, the educator comes along, and the parents most of the time see their child in a totally different way, and they see that the child has changed. He's or she is well dressed, so sometimes they accept to have their child back. When organizing these interviews, we realized that parents themselves had been the victims of trauma as well. So, of course, this is a long-term work. It is important to prepare the child for this meeting. And I remember a case when a child who went back home started to cry because the living conditions at home were not at all the same as the ones he was enjoying in the reception center. So this is a problem for the integration. Well, I do not know whether you can hear me, Mr. Mifundu. Try maybe to come to an end, because there are other requests for the floor here in the room. So I can say that the biggest problem when it comes to the reintegration of children is that they have lived under different conditions that have nothing to do with what they have at home. So it's important to address that. So the common points with the other panelists are that we have been working with children who have been traumatized, and the trauma continues. The trauma is still there, and so they might experience trauma once again. We are talking about children here, so it's important to help them go back to school, and school, of course, plays a major role. We have to help them, we have to prepare them so that they have the appropriate tools to face the future. They can go to school, and they can also benefit from this life education, so to say. All right. Who else? Thank you very much indeed, and congratulations for this remarkable work that you conduct on a daily basis. So we were talking about going back to school after a trauma. Well, I would like to highlight the role of teachers here, and so I would like to know whether you have been working with teachers. Have you prepared them? Because it's important also to speak about teachers' mental health. I do work for Annabelle. I am an expert in education, so we work with Burkina Faso, and of course we know that teachers over there are the first victims of a conflict. So do you work on the mental health of teachers? Do you help them? Do you prepare them to cope with traumatized pupils? Well, yes, this is one activity area for us. So we talked about secondary stress, about vicarious trauma, and it's important to make sure that teachers are well aware of the existence of this type of trauma, and they should know what they have to do if they have to deal with a traumatized child. If all of a sudden you have a child who is not participating, who is totally locked in himself or herself, for instance, or on the contrary, when you have a child who is literally really exploding in the classroom. So we know that children sometimes have been rejected. They have been expelled from school because actually teachers didn't know that they had suffered a trauma. So yes, we do work with teachers. This is key, also, as you rightly pointed out. And we know that teachers are sometimes reluctant to have traumatized children in their classrooms. Sometimes, the conditions are extremely dire, their wages are not that high, so they do not want to have to face with an additional burden. And as you have explained, we do work with displaced populations, and it's not always easy to raise awareness amongst teachers and to make sure that they accept and they agree to have traumatized children in their classroom, and we have to explain how they need to react. So this is maybe one of our weaknesses, because we do not really help teachers address their own mental health issues. We bring forward solutions for children, but not so much for teachers. All right. I also would like to share a personal experience. In Kinshasa, we trained many people who belonged to local organizations, and the idea was for them to reach out to excluded children, street children. They would go and work with the families and ask what had happened. I have the feeling that sometimes we tend to forget the deep root causes of these traumas. So it could be a conflict, it could be a war. If you take child soldiers, very often those children are ready to enroll in the army. And this is also a way for them to escape a very difficult family situation. So I think that it's important to have a discussion with the family first, not so much to work on the reintegration of the child, but simply to understand why they have left and why they have suffered this trauma. So it's not only about the integration of children, it's also about finding out what has happened and what could be done to help them. So when it comes to the training of stakeholders, we have to understand what is their own experience. As a first reaction, we see that the children are rejected because this is an easy solution. The first reaction is to expel children or to reject them. And of course, when we come, most of the time they tell us, well, what's the point? Why are you here? What are you going to do? So it is important also to discuss with the families. They should be able also to have a say. If, for instance, you train a former teacher, well, you hear that they are afraid of the various beliefs. And teachers are sometimes afraid of being bewitched. So I think that it's important to work with healthcare professionals, but it's important also to work with community leaders and community people. So that's the reason why we keep talking about a holistic approach. I also wanted to ask, when you try to help little boys and little girls, do you use a gender-based approach? Okay. So we have two different centers, one for girls and one for boys. So now this is very clear, because simply the care that we provide is really not the same. most of our girls are mothers themselves, so the way we will receive them is totally different. Most of the girls are seen by a hospital department dealing with sexual health. So this is really specific to girls. And I think that both groups receive sexual education. When it comes to girls, they are the victims of sexual violence, and it's also the same for boys. But when it comes to boys, we can also have little boys born, and I'm looking for my words here.
Les coupables de violences sexuelles, oui, c'est ça.
So they are also the victims of sexual violence or survivors. They are survivors of sexual violence.
Il faut savoir que les petits garçons qui ont commis des violences sexuelles,
little boys who committed sexual violence, sometimes they were obliged to do so, or they did that under very specific conditions. So we have to work on all these issues. I do not know whether I have answered your question. We do work with groups of girls, because most of the time they have been the victims of sexual violence, or they delivered children born out of a rape. So when we help boys, we teach them how to respect one another. This is one of the guidelines in our program, and so we can also conduct joint activities. When it comes to the prevention campaign, we try to have as many fathers as possible. Now, it's not always possible, obviously, but we try to work with mixed groups, and of course, there are more mothers than fathers who attend, but we keep on trying. We try to involve as many dads, as many fathers as possible. We try to work on gender equality. There again, there are campaigns on the radio and on TV. Thank you. Well, if I may, I have two short questions. You have been involved in Pansy for 10 years. Have you conducted a follow-up of all your cases? Do they know what they have become? Do you have any information about that? And can you involve those people now who are now adults? Do they become, or could they become trainers themselves? Are they involved? So what have they become? So, unfortunately, we have received them when they were very young. So it's difficult to say. For the time being, most of them are still at school, but some of them are old enough and they have become mothers themselves. So this is interesting, because we now have a certain visibility. We see whether or not they have been able to have children, how do they behave. When it comes to the children born out of a rape, it's still too soon to say. I think that the oldest is 12. So it's still hard for us to speak about the adult they have become. But what we know is that, in Bukavu, there is a lot of insecurity and there are still conflicts. And we know that the children who have followed our program, they are well, they are doing well. Now, we hear this from clinicians who work there in the field. But I think that, yes, you're right, we will have to see them again. We will have to conduct some tests. Now, we do have an app and we are using psychometric tests. And of course, this is an approach that is not too binding, and we use an avatar. We called it a cookie. So thanks to this app, field workers can reach out to those children and see what they have become, if they are doing all right or if another intervention is needed. So you keep in touch, basically. Yes, this is a 3-year program, and year after year we try to conduct tests to have some clinical tests, and that's also the reason why we work with local clinicians. Now, of course, some might argue that it's not a good idea, that we would need to take people from the outside, but no, this is the choice we made. We do work with local people. They have the phone numbers of the families and vice versa, and should there be a problem, they can call those clinicians, and so we can decide all together what's the best solution. Well, I think that we are slowly reaching the end of our session.
Ça s'adresse à Dr. Mufundu, mais aussi
I had a question to Dr. Mifundu. It's a question about soldier children. I think that, sometimes the families simply want to get rid of them so that they do not have to feed all of them. They do not have to feed so many children. So sometimes they simply just get rid of them. So you said that you were trying to have those children returning to the family. Well, are parents enthusiastic about seeing their children coming back? Because maybe they might not have the necessary money to feed those returning children.
Ce n'est jamais seulement ce problème-là. Il y a toujours.
Well, there are many problems at the same time. So you have the financial situation of families, or if there is a new wedding, most of the time the children born in the first marriage are expelled, they are excluded, because it's about rivalries, competition within families. The second wife does not want to feed the children born in the first marriage. So what can we do to address those questions? Well, I think that most of the time we need the assistance of a friend of the family. Someone who is a friend, someone who knows the family, someone who is a mediator, so to say. So someone who knows the family well, so we can work with them, we can think about their experience, what happened before the child was expelled from the family. Now, we are not always successful, but if we do not speak, it's even more complicated. And sometimes, the parents and the child will realize that it is in their interest to keep in touch. And so maybe they could agree on a solution. For instance, the child could go back to the family from time to time. So I think that it is a learning process. So I think that it's important to try and to make sure that families can change. It's not only about the number of children they have to feed. It's not only that. Dr. Mifundu.
On vous écoute?
Yes, Dr. Mifundu, the floor is yours. If I may reply to this question. Yes. We have to finish in 4 minutes, so yes, you may go ahead.
Est-ce que je peux?
Écoute.
Ok. En fait, la réinsertion, c'est un travail qui est...
Reintegration is quite a task. It requires preparation. Now, the child does not have to go back to the nuclear family. And in the preparation phase, we try to identify who could take care of this child. In many cases, it was decided that it was not the parents who would receive the child. So we try to find other persons, other carers, and we try to establish positive links between the child and these other family members or someone else. So in the preparation phase, we identify a carer. We prepare this person, and so only then the child can go back to the carer. Now, if parents are willing to take their child back and if they have financial issues, there is always a possibility to find some support, and this is decided on a case-by-case basis. And sometimes we can help parents have a new activity that will generate some financial income. So we try to identify the most appropriate person, the most appropriate carer who will be there for the child. And as you said, we talked about wizard children. This is quite a thing. This is quite a phenomenon. So this is what we do. We try to identify the person who is the most likely to take care of the child. And if it's not possible, depending on the age, the child could be autonomous. Thank you.
Yes, before concluding, maybe just a few comments as far as our meeting is concerned. Yes, I come from a multi-crisis country. This is a very interesting work. Thank you, Mr. Mufundo. Thank you, Mr. Jack, because I think that you need to be dedicated to do that. Certainly in my project, because my project is quite similar to yours, I try to raise the awareness of the community for them to understand that it's not a question of being a wizard or a shaman or whatever. Mental health is a need. It is an essential need, and I discussed that with Sharon from VVOB beforehand, and it's very interesting to understand that mental health is essential. If mentally we are not okay, we cannot act properly. And during this whole day, it was very inspiring, and I came to the conclusion that education and mental health are important for collective and individual resilience. Because otherwise we cannot do anything. I took down a lot of notes and I will go through that. Thank you to you, to all the participants, all the people here, because health want also to thank the different partners, the speakers for their participation. Thank you very much and have a nice day indeed.